Big question. Do people die of fever? Donna, there are certain weather conditions. Is it really true that weather can cause fever?
A lot of old people in Trinidad say, "Oh, you got wet in the rain, you're going to get sick."
Should you wrap yourself up when you have fever or should you unwrap yourself when you have fever?
You do not want to bundle up at all.
Okay.
Right, to see like many, many layers. You may.
Why is that we still see fevers like dengue? Why is that we still do not have the control that we wanted to have?
And remember, the mosquito is not only going to stay where the water is, they're going to fly, they're going to go around. So we can't really control the weather pattern so easily. But
Why do fevers raise in the night or in the evenings and they're okay in the mornings?
white cells, which are your defense cells, they're producing.
What is a safe dose of medication for fevers?
I would say with if a child or if a person has asthma, for example, that cold temperature can trigger off an asthma attack. With children, they do not have the robust immune systems that their parents have. So
Trinidad and Tobago reported 825 cases and 8 deaths in August. Jamaica's severe 2023 outbreak with 1,234 cases and 9 deaths. Dengue remains a major illness in Grenada, Guyana, and Dominica. We are talking about various types of fever. There is a new virus alert we are observing in the Caribbean countries, which is listed by the CDC, which is Oropouche virus. 1950s yellow fever outbreak in Trinidad and Tobago has resulted in a mass vaccination campaign by TRVL, and finally they have attained the herd immunity. Welcome to Medicus. My name is Varun. I hope you're all doing well. Today's topic of discussion is about virus. I'm sure every one of you would have had someone or the other who had been affected with virus in their family. However, majority of us know what is virus. There are certain areas that we still have some confusions and clarifications that are necessary with regards to virus as a medical condition. In order to discuss this topic, we have Dr. Donna Rampersad. She's from Trinidad and Tobago. She has a clinic named Western Medical Clinic at Port of Spain in Trinidad and Tobago. She is an internal medicine specialist and also a general physician with close to 10 years of experience. Let's welcome her.
hello.
Hi, Donna. Very good morning. Thank you so much for accepting our invite and joining this session today.
Thank you.
Great. Donna, I'm sure we have discussed this earlier as well. Fever, though it sounds very simple, this is, I think, the stepping stone for any of the medical conditions to be observed or maybe to get ignited in our body. So what I want to ask you as a first question is, fever is equal to high temperature, right? So the first
Right.
question is, what exactly is fever? What happens in our body when that triggers these high temperatures?
All right. Well, thanks for having me. So, I would love to talk about fever. So, when you look around Google, they'll tell you a temperature greater than 38 degrees Celsius. But the truth is that you can have a lower grade fever, less than 38, and it's still considered a fever. So, for example, if you dig a little deeper, a temperature greater than 37.3 degrees Celsius. Usually, the low grade fevers are what we call benign, they're harmless, right? But you may wonder, well, am I sick? Should I be concerned? Yeah, fever is your body's way of telling you, hey, something is wrong, and I'm trying to correct myself. So it's a little, I wouldn't say red flag, but it's a pink flag that says, look at me, I'm not my normal healthy self.
Doctor, if we go a little deeper with respect to this fever, right? So what happens in our body, just like how a chimney gets ignited with the fire, just like how a car's engine gets heated up with the combustion, what happens in our body? Is there any furnace? Is there anyone who's actually turning on the wood in our body which is creating that heat? Why is
Right.
that heat generated?
Right. So we all have an immune system. right? Healthy persons have immune systems, and you can think of germs as invaders into your home, right? And we have special cells called white cells, and these are like your defense system, your police, your security, right? So you get this germ, this invader coming into your home, your body, and the security alert says, "Hey, who are you?" And if it is that, nothing too harmless, they'll just say, "Okay, somebody strange is here." But if more and more invaders come, the first line is to sound the alarm, right? And the sound the alarm would be to generate this fever. And
Oh,
basically, it starts with these police cells, these white cells. They send off some chemicals, and it causes the body temperature to rise. And of course, I'm speaking to the most common type of fever here, which is due to infection. We can talk a little later. It's not always due to infection. But yeah, in this scenario, your invaders have come in and the alarm goes off and the chemicals are released and you have your body temperature raising. And this is to make the intruders uncomfortable. So
right, right, right,
yeah. So they don't like the heat. Some of them will stop at the door. Oh, it's too hot here. I don't like saunas. I'm going. And
right.
the stronger ones will say, "Oh no, I'm still coming in and I'm still
Okay.
bringing in more people." Yeah.
And the heat continues to rise to check if those invaders could really face the heat and defend that heat or not. Fantastic way of explanation, Donna. Thank you so
Yeah.
much for that. So, as we are talking about various temperature levels, what is the temperature every person should look at as an alarm to reach out to a doctor or to reach out for some sort of a medical assistance?
Right. So I wish there was a black and white answer to this, right? I think you have to trust your gut and your intuition for the most part. Um, but I would say an alarm temperature would be like 39.4, definitely. Beyond that, I'm not too good with Fahrenheit, but I did do a quick Google. It's 103 Fahrenheit. But I
Oh,
will
okay.
say that if you could be less than that. You could be 39, right? And I don't want somebody to say, oh, the doctor said 39.4. I'm less than that, so I'm good. You look at the person, are they looking listless? Are they not themselves? Are they um disoriented, so it's never like, okay, doctor said 39.4, so therefore we are good, we are less than 39.4. You have to take the whole package, and anything that worries you, it's better to be safe than sorry.
Right, right, right. Thank you. So, on the same context, Doctor, there are several scenarios we see in every houses that fever comes and goes, and it happens very frequently. Why does it happen?
There's a fancy term called circadian rhythm, but it's basically
Mhm.
our body has a way to do things, and not to be biblical, but there's a time for everything, right? There's a time to be awake, a time to sleep, a time to eat. And this rhythm that our body follows, controlled by certain chemicals in the body. We may have heard about cortisol. Everybody talks about that when they're stressed out. This cortisol is higher during the day, and it's basically saying that you can fight and regulate better in the day. But when the nighttime comes as part of your body's natural rhythm, even when you're not sick, the cortisol drops. So you're more like your defenses are lower. Your guards are sleeping. You forgot to arm the house, right?
Right,
And that's when the fevers will show up. It's not that you got better during the day necessarily, but it's your defenses are down, and then that is why the fever tends to be more prominent in the evening time.
right.
So yeah.
Great, great. Thanks for that, Donna. I mean, on the same context, we are talking about why do fevers raise in the night or in the evenings and they're okay in the mornings. Can you go a little bit deeper and elaborate on that context? Because this is again a very common question by a lot of people.
Well, I mean, I think that if persons had a fever in the night, they got up in the morning and they start feeling that I don't have a fever, and then they get worried when the evening time comes. You get this fever again. Um, I mean, without being too complex about it, they're the same white cells, which are your defense cells. They're producing chemicals, and the production is higher when you
Oh,
have the fever, right? So it's sort of like your body's way of is better at regulating it during the day, so you're not getting the fever monitored on the thermometer, but it would be evident in the night.
Donna, is it also something which is similar to, because we have all observed that when you sleep in the night, usually your body temperature rises. There could be some science behind it. Is that
Well,
also Mhm.
actually, your body temperature drops in the night.
Oh, is it? Oh, okay,
So
okay.
yeah, so you may have noticed this, like you go to sleep and you are a little hot when you go into your room if you have a fan or air condition, and you don't have any blanket, nothing. And then you
Okay,
fall asleep and then, oh, I'm cold now, right? This
okay,
is
got it.
this is not when you're sick. And then you start to bring up the blanket. So if you have an AC, you might take it off. So your body, that is again part of that same rhythm. Your
Okay,
core functions drop,
okay,
decrease. You're not doing much when you're
okay.
sleeping. So your body's core temperature drops. So
Right,
everything goes really screwy when you're sick.
right, right,
Actually, I would say if you had a normal temperature, normal, in that time where it's supposed to drop, then it may not be that alarm 39.4, but you're not well.
right.
Yeah.
Thanks, doctor. Are
Okay.
there any fevers that do not drop the temperatures at all?
Yeah, so those are the ones that you want to be concerned about, right? Now we have different categories of fevers, Um, we, but there's one that continues for weeks, right? And that is definitely a cause for concern. I would hope that anybody would seek help before this 3 week mark, but definitely when you've had a fever persisting for 3 weeks, and you haven't quite figured out why, we call it a fever of unknown origin. But that really is just a term until we figure out the origin. We don't just leave it there like, oh, mystery fever. We try to figure it out.
Okay.
And those may not be infection. It may not be the germs and stuff causing that one. Yeah.
But it can be of anything else, which ideally is revealed through some investigations, right?
Yeah, and it's definitely a cause to see your doctor, and we begin that process of talking to you, what we call the history. If have you had any sick contacts? If anybody else sick, have you eaten anything out of the ordinary? Are you having any other complaints along with the fever? Have you traveled? Because we have this global village. So we always have
Yes,
to think about, okay, there are endemic things to your country, but if you went to South America recently, maybe I need to think about other causes of fever. And then we would examine you, and there are certain things that we'll be looking for in the body that would be alarm signs. And then there would definitely one prompt us to do investigations, blood investigations, maybe a chest x-ray. And we would just take it from there. The idea is to be guided in what investigations we need. Some people, when they really can't figure it out, you cast a wide net and you see what comes up.
exactly. True.
Yeah.
There is a big question here, Donna, which everyone should probably are looking for. Should you wrap yourself up when you have fever, or should you unwrap yourself when you have fever?
You do not want to bundle up at all.
Okay.
Like to say
Okay.
like many, many layers. You may be shivering and so, but your body wants to let off heat, right? And
Right.
you need to. I would say cool, breathable fabrics like cotton if possible. And one, you definitely don't want to douse yourself in cold water or be in a cold room, right?
Okay.
But you do want to have airflow on the skin.
Got it. So you should not bundle up. You should not wrap yourself up. Okay.
No,
Definitely not with many layers. Okay. Great. Thank you.
definitely not.
Absolutely. Donna, there are certain weather conditions which may trigger to raise the temperatures in our body. Is it really true that weather can cause fever?
So the short answer is no, right?
Okay.
But I will give the caveat that so infections are caused by bacteria, virus, fungi, germs, right? So there's an old wives' tale. A lot of old people in Trinidad say, "Oh, you got wet in the rain, you're going to get sick," right?
Right.
As if the rain is like bacteria and virus falling, right?
Right.
No. But what we do know is that being cold can cause certain changes in the body. So
Okay.
if the child or if a person has asthma, for example, that cold temperature can trigger off an asthma attack just by not because of germs, but it causes the airways to constrict. And if you're not breathing properly, they may be more prone to getting sick. Now, whether, when it gets cold, maybe in a temperate country, people tend to stay indoors more, and being indoors more, you're breathing in circulated air. You're more likely to be in closer contact with someone than if you're out in the open. So there's a relationship, but it's not causal, you know?
Right, right.
Yeah.
Got it, doctor. Doctor, there is this, again, this particular phenomenon that we see in our houses, right? It is extremely important for everyone, especially the parents, should be aware of, because we are living in a society where even a smallest trigger of a fever to our kids, we tend to go to a doctor, or we want immediate results. We want immediate recovery or quick recoveries. We really don't have time just with a tap of a button, just like we have got used to this technology. We want our body to be also to be working in the same way. You being a mother as well as a doctor, what do you think is a normal fever tenure for adults versus children?
Right. No, the pediatric population is more sensitive, right?
Yes.
Than the adults. So, I say in both, we would say like about 5 days, 1 to 4 days, 1 to 7 days for an adult, out of this febrile phase. But with children, they do not have the robust immune systems that their parents have. So you want to intervene quickly for
Okay.
children, right? So we have a structure in our brains, right? It's called a hypothalamus. But basically, in adults, it's a temperature regulator, among other things. But it says, whoop, it's getting too hot. Yes, we want to make it an uncomfortable environment for germs, but our bodies need to work at a certain temperature as well. So when it gets too high, this structure in your brain will shift things around and keep it under control. Children don't have that mature system, so their temperatures may skyrocket and they can get seizures. So seizures are
Oh,
fit, it's a fit. So and it's it's very hard to look at. Yeah, even if you're in the field and you've seen them before, when it's your own child, it's terrifying. Arms shaking, legs shaking, not responsive.
right.
So so they call those febrile seizures. And we used to think that those were very innocent, maybe like 20, 30 years ago. Oh, you get a fever, you get a seizure, and then you get better. But neurology research and stuff has shown that repeated febrile seizures can cause effects on the brain in the long
Okay.
term. So with my kids and with all the children that I treat, we want to regulate their fevers pronto. So paracetamol or ibuprofen at their correct dose for their age, and weight is really for their weight, really. Intervene quickly. For adults, adults want to get better fast, but I am a strong proponent of, it's a low grade fever, 38, it's your first day. Unless it's very unbearable to you, I would say ride it through, because I mean, there are jokes on the internet that where they say, oh, your body's trying to help you, and then you just undo the work that your body's doing. So
Yes, yes.
yeah, that's right. True with our fever a little bit. So a little bit of fever is not bad. A lot of fever, it could be bad. So then we can intervene then.
Doctor, we have been talking about fevers as well as different temperatures and all with respect to when should you see a doctor and when can you wait. Now, can you talk about some common fevers or common causes of fevers in the Caribbean? Also, maybe you can discuss about some common fevers that you see around the Caribbean islands.
I think that there's fevers are throughout the world, right? But if we're speaking Caribbean, South America, Central America, we want to think of our weather climate, and we don't have a temperate setup. It's really dry season, rainy season. And what we find is that the wet months, the wet season, causes a surge in mosquito-borne illnesses. So there's a cycle, you So our wet months would be from like June to December, roughly. And that's usually around the time where you get these mosquito-borne illnesses such as dengue fever. Maybe like 5 years ago, we were talking more about Zika. Chikungunya was, a hot topic before as well. But the common factor is that these are mosquito-borne and that they are surging during the wet months. Now, more recently, we've heard a little bit about the Oropouche virus. Have not heard about it surfacing in Trinidad for this season or last season, actually. Interestingly, we have a river called the Oropouche River. I don't know if it has any bearing on the name of the virus. I'll have to check that one out. But again, mosquito-borne illnesses. So there will be large public health campaigns about, if you're collecting rainwater, keeping them covered. Even if you have plant pots with little sources underneath, just that little bit of water, the mosquitoes can lay their eggs in it. There's been a lot of public health outreach to encourage persons, not to unscrupulously discard their trash because, that's where the water is going to pool. That's where you're going to get these mosquito laying the eggs, which is going to come back to have the dengue surge that we see here all the time. And Trinidad is not unique to the outbreak. All the islands have similar rainfall patterns. Um, we in terms of public health approaches, I mean, yellow fever was back in the 50s. That would have been, in my grandparents' time. One that we had a vaccine for, right? And that is the yellow fever is no longer there were no cases if you look at WHO
Yes.
sites. No cases 2020 to 2024, but that was a
Yeah.
nationwide campaign for vaccination.
Correct.
Vaccines were free, and we're fortunate that we have about roughly a 90% enrollment rate in primary schools in Trinidad. So, and one of the ways was to get into primary school, you had to be vaccinated. So that
Oh,
way, it actually, so if you look at, it's odd, the primary school enrollment, let's say, is about 90%, and that is roughly the yellow fever vaccination rates as well. So tying those two ministries together has pretty much squelched, I guess, if you want to use that word, yellow fever here. We don't have, vaccines for Oropouche and Zika and so right now it is really prevention versus cure because there's no miracle drug either,
right.
there's so
Correct. Correct.
one so I will say it like one in four persons who gets dengue, for example, they will get sick. The others
Mhm.
mild or no not even realize. But
Yeah.
what we have to look out for the severe ones that need hospital, that need close monitoring, um, and to do what we can to prevent those dengue related deaths.
Yes, Donna. So when we talk about these different kinds of fevers, we either speak about the recent outbreak that has been listed by the CTC, which is Oropouche, or we go back in times, we talk about chikungunya, we talk about Zika related virus. Are all these viruses caused by mosquitoes? Okay,
But the
so
Oropouche, there's another insect that midges. So there's another kind of flying, biting bug. The others, not Oropouche, are mosquito borne. Oropouche is also mosquito borne in addition to the midges.
okay, okay. But my
Mhm.
question, Donna, is why is this, despite of several campaigns, despite of public awareness, despite of the CDC giving different warnings, instructions, safety mechanisms, health and hygiene mechanisms, why is that we still see fevers like dengue? And of course, these are not just stopping at the fevers. We see them remaining as fatal diseases as well in certain mankind. That is not just restricted only to dengue. We also talk about chikungunya. I believe these both will also affect the platelet count in our body, subject to correction.
Yeah.
You have to say, yeah. But why is that we still do not have the control that we wanted to have? Is it only because of the public awareness, lack in the public aware? When I say lack in the public awareness, lack in public hygiene, despite of the awareness, or is that something you feel personally that we should do more than what we are already doing?
I think that, every organism wants to survive, right? So the mosquitoes are probably going to be around after man, right? So, I think that we have a real problem with flooding in Trinidad.
Okay.
Some persons live in very low-lying areas, and every single year it's in the same areas you see flooding happening. And it takes a few days for those floodwaters to subside. So and remember, the mosquito is not only going to stay where the water is, they're going to fly, they're going to go around. So we
Yeah.
can't really control um, the weather pattern so easily. But I guess infrastructure to prevent flooding, on one hand, it's a public sensitization. There's still persons that, even though it's against the law, they will throw a fridge in a river. Like, why would you do that? It's gonna clog, it's gonna go down, and it's gonna clog
Clogged.
a
Yeah. Yeah.
narrow
It's correct.
and it's gonna cause flooding in a downstream. So I think it has to start from the schools, and then go straight up, as stricter fines for unscrupulous disposal of garbage, particularly large things like fridges and even tires. That's been a problem. Everybody has a car, right? And
Right.
then, but the cars need to change the tires. And what are we doing with the tires? We're flinging them in the river. We shouldn't be, but
Right.
there were people that would do that. So
Yeah.
so that's it on one end, controlling the flooding, and the other end, and then just public awareness. So, like when Zika was surging within the last 10 years, we haven't heard too much about it in the, I would say, the last 4 or 5 years. But before, it was a big concern for pregnant women, because what it was causing in the pregnant population was babies with microcephaly, small heads, right? And some of
Mm.
those pregnancies wouldn't go to term, and I
Oh.
mean, so some of them did survive, but then you have this, it's a small population, but a population nonetheless, of the microcephalic children that are still, have special needs, and they're growing.
Oh.
So that was a big scare in that population. So, people would, even though the temperatures are hot, would wear long clothes, mosquito repellent. Um, just try to, especially in the evening time, we go, the mosquitoes come out, stay indoors, mosquito screens on the windows.
Right.
I mean, I have two kids, my daughter's 3, my son is going to be 5 next month. And their dressing and bedtime routine, morning and evening after baths, mosquito repellent. My daughter
Right.
says,
Right.
keto, if I don't do it, keto spray, like I have to. It's part of it.
Well,
Um,
there is another side. Sorry to cut you down,
yeah.
Donna. There is another side of the argument where people say that these repellents are chemical oriented, are chemically bound, and they also cause other type of side effects to our skin. So, what is your argument, or what is your thought about it?
Well, for sure, some people have very sensitive skin, right? And you spray those things and their eczema will flare. In general, persons with eczema, they can't take anything that's highly scented. The citronella tends to be very well tolerated. There are
Okay.
some clip-on devices that you can wear on your belt buckle, for example, that gives you a layer of protection. So in such a case, if you know you have sensitive skin, and so you can use the long protective clothing and maybe a clip-on. Even something simple like a fan, right? It's not going to kill the mosquito, but I mean, its little wings can only do so much, right? If a fan is blowing
Exactly.
on you, it's not,
Exactly.
it could gonna come and it's gonna fly and not be able to
Correct.
bite you. Yeah.
Exactly. Those are all old school methods of actually
Yeah.
letting go of the flies, even the flies for that matter. Yeah. Thank you, Donna. Yeah. So, Donna, we are talking about identifying what kind of a virus in this kind of a discussion. So, ideally, apart from a thermometer, when anyone approaches your clinic, what kind of diagnosis do you perform or investigations do you perform to identify what kind of a fever it is?
So that's the first thing, the thermometer. But sometimes persons come and their temperature is normal, but we already discussed that it could be cyclical. Maybe they came in the daytime, but in the nighttime the fever was high. Um, Again, we start with a full history, sick contacts, travel, any other symptoms or complaints the patient may be having, and then we'll examine them. Some of the red flag symptoms would be a rash throughout the body. A tender belly is never a good sign. Um, we look at the gums and the nose. Does it look like it's bleeding or has been bleeding recently? Those are also not good signs. But then I would say the first modality would be a blood investigation. And we would start with the complete blood count or full blood count. And what are we looking for there? So we mentioned before the platelet count. Everybody
Mhm.
has platelets, right? But what we're looking for is a low platelet count. And what is more alarming than a low platelet count is a dropping platelet count. So it is not
Okay.
wise to say, okay, I check my platelets, it's 100, which is low, and say, okay,
Mhm.
bye-bye, feel better. You want to check it again the next day to see that it is starting to rise. And if it's dropping lower, you have to closely monitor that person. I would say tell them to go to hospital. Once it's on the rise, you may be okay, you may be out of the woods. And we also need to know the onset of the fever because we've found that there have been precipitous drops in the platelets after, let's say, 4 days of fever. So you can't say,
Okay.
okay, today is Monday, my fever started Saturday. And you can't look at that normal platelet on the Monday and say, oh, you're fine
Okay.
because we may not have reached that threshold. We also look at the hematocrit, right, which is something that's usually a result that gets churned out from the full blood count. A rising hematocrit could be a warning sign. But I know that the average person, this may just be Greek to them, but what most people, even my, non-clinical patients, they are lawyers or they're shopkeepers, they understand the platelets and they
Okay.
understand that mine is low and it's dropping. And that is
Okay.
something that sort of patient education is great. The
Thanks.
CRP is non-specific, but it is a measure of inflammation. So we can use
Right.
that to monitor. Another blood test that we can do, we can check for dengue, right? So now there's
Mhm.
IgM, IgG.
So I was
Now
going to ask you that,
yeah,
Donna. Sorry to interrupt you in between. So
yeah,
you kind of mentioned CBC that actually gives
yeah,
you a different counts of different parameters in your full blood count. Like it could be
yeah,
RBC, WBC. It may
right.
also have hemoglobin level, etc. Right? When do you determine that you should do a malaria test for this patient, or a dengue test for this patient, or some other test which is a fever-related test to this patient? What parameter is going to give you that information or an insight?
So you have to look at this time of year, right? If it's March, I'm not going to do a dengue test, right?
Okay.
Because we know that dengue tends to be a mosquito-borne thing. Not that it can't happen, but maybe not. But if I see a low
Okay.
platelet, then I will start to investigate for why I may have a low platelet. Malaria is not endemic to Trinidad, right?
Mhm.
So it's not going to be a test that is readily available. But then again, it always starts with a history. Is this person, let's say, a merchant, and they go to Guyana or some parts of South America to get goods, to bring them in? Um, they may have brought some mosquitoes with them on the boat, and that's not me being funny. They didn't get that mosquito in Trinidad. So then, we would consider malaria in those cases. And malaria has what we call a swinging pyrexia. So you chart
Mhm.
the temperatures and it's like that, like a sine wave,
Okay.
like a hammock up and down. And it's
Okay.
reasonable then, and it's not easy to do. So there's a team that serves the country, and they will come
Mhm.
and they will do the malaria smears for you. But you have to think about it. You wouldn't do a malaria test on every old Joe. But
Okay.
again, you're thinking along those lines. So we had said IgG. So dengue IgG does not mean current dengue. It means you had dengue in the past.
Oh,
Dengue,
okay. Okay.
yeah, dengue IgM means that you have it now because the M.
Okay.
So these are fancy term immunoglobulins, and these are chemicals, for want of a better word, that your body is producing in response to an attack from a mosquito-borne virus in this case. And there's more than one type of dengue. There are four strains of dengue. So you may have had another type before, and now you have a different type now. Oh, and there's another test. It's a rapid, I think it's called an NS1 that detects the dengue earlier.
Right.
We've gotten a lot of testing for dengue because of, there has to be a nationwide response to the deaths. And so from previous years, you mentioned like the outbreaks. So that,
Exactly.
that has been the response for dengue testing
Sure.
and recording.
Everyone talks about viral fevers. This has been a term to use a lot of times. I also heard another term called bacterial virus. What is the fundamental difference between a viral fever and a bacterial fever, doctor?
So off the get-go, there will be no, you don't know if you just have a number on your thermometer, right? Now there are some very serious viral fevers and some very serious bacterial fevers as well. But I think anecdotally, we tend to think that the bacterial fevers tend to be higher. And they
Hmm.
tend to be more robust and last longer. But remember, if you just do a snapshot in time, like this one patient walks in, you don't know them from before. They may not, come back to see you. You don't know just from talking. So there's like bacterial meningitis. Some people may have very bad headaches and neck pain with it. But then there are also viral meningitis too, and they will also have the headache and the neck pain. So one of the investigative parameters would be a blood culture. Now, a blood culture will not grow viruses, but it can grow a bacteria that's in the blood. So that would be another modality, but that lends itself more not into outpatient clinic, but into the hospital. So
Right.
yeah, which is where
Okay.
I've worked for the last 10 years.
Sure, sure.
Yeah,
Yeah, doctor, this is a question straight from a lot of patients. Okay. So they've been saying, or they probably would want to know, why is that doctors prescribe antibiotic medicine for a viral fever? Because they Googled and it seems they found that antibiotics do not work on viral fevers. Yet
correct.
they have some doctors prescribing antibiotics for viral fevers. Why is it happening?
I want to tell a joke, right? So they say if you get the virus or the flu, right, a cold viral, common cold or the flu, that you will get better in 7 days. If you take medications, you'll get better
It
in a
takes a week.
week, right?
I've heard that too,
So,
yes.
so the thing is, it's an old joke, but it tells us that if you have a virus, with or without the antibiotics, you're going to get better. So initially, before we knew a lot about antibiotic resistance, no harm, no foul, right? If it's a bacteria, it will kill the bacteria. If it's a virus, it won't do anything to
Okay,
it, but the person will get better because that's just the
right.
natural course of things. You're going to get better. We are smarter now because we know about antibiotic resistance, and
Hmm.
you look for certain signs before you would prescribe antibiotics. So you should, like, if your throat is hurting, that's not a
Hmm.
reason for antibiotics. You can swab,
Okay.
see if you grow something. You can do this full blood count, look at the white blood cells. If they're high, then that happens in bacterial infections. It suggests that an antibiotic will work. Um,
Hmm.
but I also want to say that there's also bacteria superimposition on a viral illness as well, right? So what may
Okay.
have started off as a viral chest infection, for example, um, you got a bacterial infection on top of that, right? And that's usually comes kind of into the realm of where the internal medicine doctors may decide for a course of antibiotics, but it's usually guided on imaging and investigations like blood tests and so. So short answer is, not all fevers need antibiotics, but if you are prescribed antibiotics, because we're very litigious, right? Which is the shameful part of it. If you go to a doctor and they don't give you antibiotics, and you went to another doctor who did give you antibiotics the day after and you got better, you might say that first doctor doesn't know what they're talking about.
It's all in the
And
mind. I know what you're talking about.
yeah,
Yeah, absolutely, doc.
so what I will say though is that if you are prescribed antibiotics, the duty is to take the full course because the problems
Right.
arise when you don't take the full
Take
course
the full
and
course.
you
Yeah.
you end up getting resistance. And
Right, right,
and
right.
that is why we are so scared about just flippantly prescribing antibiotics. We don't want a resistant population. So
Correct, correct,
yeah.
doctor. I agree with you. Doctor, there is in your case, when I say in your clinic, you must have seen a lot of patients. Was there any situation where a patient has walked in, but it took so long and it became so difficult for you to identify what kind of a fever it was? And finally, you were very happy that you're able to find the root cause of it and what kind of a fever it was, and you're able to treat and send off that patient. I'm talking about the most troublesome case, doctor. Can you discuss about any case study of in your experience?
So you're going into the realm of fever of unknown origin, right? They have fevers, they're documented, and you don't know why. Your blood cultures come back negative. The blood count, you do a full blood count, the white cell is not very high, and you don't know why. So I would say it could be in interesting cases. Where the patient did not know that they had an illness. So you're a chronic illness and you're now diagnosing it. So there's a umbrella term for disease called autoimmune disease. People may have heard of lupus, right? So sometimes patients with lupus have fevers. They have nothing to do with infection, but it's part of this abnormal immune system response that they have. And that's a topic that we can talk on for hours, autoimmune diseases. But really, in those cases, what it is that your body is a little silly. It's looking at your own cells and thinking that it's a germ and
It's a gym,
causing a
yeah,
fe
and
and
it's
causing a fever. But it's not. It's just your normal your body responding inappropriately. Um, lupus can be a very easy one to diagnose sometimes, and also a very tough one to diagnose because it does
oh,
affect the entire body, and it
okay,
has many mimics,
okay,
from psychiatric issues to skin to just tired, you know.
okay,
And
okay.
who isn't tired? There's so many people are
Yeah,
tired.
correct,
Yeah,
correct. But we really don't know the reason behind it unless,
yeah,
it is medically affecting this. Doc,
yeah.
big question. Do people die of fever?
Short answer, yes, but it's not so common anymore with modern advances in medicine. But yeah, the short answer is yes, people can die of fever.
Okay, okay. Now, when we talk about these fevers, we find two major categories like we discussed earlier. One is adults and one is children. Will there be any difference in your protocol approach for these fevers for children versus the adults? And if yes, what is that, that would change in terms of a protocol, doctor?
So again, always a lot more cautious with the pediatric population because of their immature immune systems. I wouldn't say a low-grade fever, less than 38 degrees Celsius going on for less than 4 days. I wouldn't be too concerned. But I would, advise that the patient go to their pediatrician or to the pediatric department at the hospital if it's persisting more. If you have a baby, though, right? And don't look at the numbers. Don't look at the numbers. Your baby is not wetting nappies. Alarm sign. Not eating. Alarm sign. Children, in some way, are very easy, right? Adults can act and pretend sometimes, but a child, when a child is not well. They're not playing, their favorite toys. They're not play. They're listless. You can give them the snack that they like the most, and they're not eating. That is a
Okay,
sick child, and you really need to be on the side of caution for those little ones. If they
okay,
have a fever, but they're running around and singing Coco Melon and eating and peeing fine, all right, no problem. Take some paracetamol, some ibuprofen if they're not allergic, and they'll be okay. But you really have to look at the whole picture when it comes to
okay.
kids.
So, doctor, what is the safe dose of medication? Now that we have discussed about diagnosis, let's also talk about the treatment protocols of it. What is the safe dose of medication for fevers?
Right, so there are a lot of over-the-counter remedies that you don't need a
Mhm.
prescription for. That's not
Okay,
antibiotics. So in Trinidad, your first route would be paracetamol. Other countries have Tylenol, which is a brand for acetaminophen, and there's ibuprofen as well. I would say with paracetamol, we want to go with 1 gram, which usually is 2 tablets because each tablet is usually 500 milligrams. No more than 4 times for the day. So usually, 8 hours apart would be a reasonable dose, but you can do it 6 hours apart as well. More is not always better for these drugs because they are processed by your liver and by your organs, and you have to read the labels and go accordingly. Ibuprofen, I would say 200 milligrams, three times a day is usually a good place to start. But again, you want to be mindful, right? Not everybody can take ibuprofen. If it's dengue, you don't want to take ibuprofen. So we have had a strong campaign leaning away from ibuprofen and that category of drugs, which is the NSAIDs, non-steroidal anti-inflammatory drugs. Because if your platelet count is low, you may end up with bleeding issues, right? So just to be on the safe side, we have said, paracetamol is not going to trigger those disastrous bleeding side effects. So we would err on that side. But if
Okay.
you know it's not dengue or it's in March, for example, it's not a rainy season, well, then you can be a little more liberal with your options.
So, doctor, which home remedies really work? Because a lot of elderly population do suggest a lot of home remedies when you have fevers in the house. Either it could be for adults or it could be for children. And how do these home remedies will help reducing the temperatures?
There've been a lot of herbal approaches to fevers, and I say, well, whatever works, right? So ginger tea has been a
Mhm.
staple in whenever anytime anyone's sick or unwell, particularly if you put honey in it. The honey they say helps your throat, but we know that ginger and garlic, for example, do have anti-inflammatory properties. Turmeric has
Oh,
anti-inflammatory properties as well. The thing that is a bit difficult is that if you buy a fruit, one mango may taste sweeter than the other, right?
yes,
So, right, but so it's not like an ibuprofen where 200 milligrams is always 200 milligrams. So you always know the effect of one pill, two pill. Whereas with turmeric or ginger, even if you said I did a spoon, it's it may not be it's not regulated. You don't know how much of
correct.
the anti-inflammatory that you're getting. So I mean, if it brings you comfort, by all means, sure, it can't hurt. Um, and I think a lot of fever treatment is supportive care and just keeping you comfortable. So in that
Right, right,
case, whatever works.
right,
I
right.
have not found them to be dangerous. So
Okay.
yeah.
So it's safer. Got it. So, doctor, what are some natural ways to bring the temperatures down quickly?
Um, so we call it fan therapy. So, just we already said we're not going to bundle up. So you're wearing cool, breathable fabric. And think about it, your body is producing heat in this fever and it's sort of creating like a mushroom around you of heat. But if you have a fan
Hmm.
that's blowing the heat away,
Got
it
it.
sort of dissipates the heat and you feel better. We would say tepid sponging, which is not cold. So lukewarm
Okay.
or room temperature water. Same kind
Okay.
of idea. It's going to sort of speed up the evaporative process.
Got
As
it.
I say that though, in medicine, we have a term called insensible losses, and we
Hmm.
lose water through our fevers, right? So, and
Okay.
you have the fan, and you're blowing away the heat, and yes, you're losing temperature, you're losing heat, but you're losing body water as well, which is why you need to keep very hydrated during your illnesses, particularly when you're febrile. Lots of clear fluids.
Okay.
Water, coconut water seems to be a staple of everybody that is sick in Trinidad. um,
Correct.
yeah,
Natural electrolytes, I guess. Yeah,
yes.
that's why everyone suggests this coconut water. Doctor, how about this honey and lemon? Is it good for fever?
I have not seen any actual trials, but
Okay.
it's thought to have some anti-inflammatory properties, and it does supposedly. Well, lemon would have vitamin C for sure, and we
Mhm.
do know that that is necessary in our immune system to keep it robust. Too much of a good thing is useless because your body can only use so much. Whatever, if you take
Mhm.
extra, you're just going to pass it out in the urine.
Okay, okay. Donna, there are some questions that we have collected, and I'm going to shoot them rapidly so you can answer them quickly, either in a word or in a sentence. So, this is a rapid fire section for you. All
Sure.
these questions have been collected from various sources. So, you've already answered few of them, but then there are certain questions that are still unanswered. So, let me just get them for you. Viral versus bacterial fever, what are the signs?
They're the same. That's a short.
Okay,
Should be doing short answers, right? They're the same,
yes.
but bacterial fevers tend to be more robust, last longer, and higher temperatures.
Okay. Why kids spike higher fevers than adults?
They have immature immune systems and they have poor regulatory centers in their brain, so their
Okay.
fevers go to higher than adults.
Okay. Fever after vaccination. When is it worry-free?
It's expected. So it's always worry-free after vaccination. It tends to be a lower grade fever though. So same overarching thing, any fever over 39.4 is a cause for concern, but a transient fever is to be expected after vaccination.
Okay. Is fever harmful during pregnancy?
It can be,
But
because
how is it? I mean, it's highly unlikely to not have a fever as just as a human. But how do you treat a pregnant woman? Maybe that could be a
right.
question. That-
Yeah, so I mean, yeah, to not get sick for 40 weeks throughout your pregnancy is highly unlikely. So paracetamol is always a good place to start. You definitely do not want to prescribe a non-steroidal agent like ibuprofen for a pregnant woman. It can
Okay.
have bad effects on the fetus, on the
Okay.
baby. So
Okay.
so I always tell people, there are people who come into office with fevers, and I said, well, what did you take? Nothing. um, you know, Paracetamol is always a great place to start. We give it to babies in the NICU, to premature babies. We give it, to pregnant women. It's safe. It's a safe place to start once you take it as prescribed.
Okay. Okay. Great. Great. Can fever cause dehydration quickly?
Yes. So we mentioned the insensible losses. So if you have
Okay.
a higher grade fever, in addition to the ambient temperature being hot, you're going to lose water and you're going to get dehydrated. And some of the clinical signs that we'd look for: a dry mouth. Well, I'm trying to think of things that the population will be able to do, but the skin looks very dry as well, too. There's something known
Okay.
as a capillary refill. So you could do that at home. You just kind of squeeze down on your thumb
Mm-hmm.
very hard and then
Mm-hmm.
you let go, and then it's supposed to pink up nicely within two
Okay.
seconds. If it's very
And
sluggish, then that person is dehydrated. So
oh, okay.
yeah, so that's
Okay,
something
great. I
that,
mean, I
that you
never
can
knew
do.
this. So you pinch on your finger, and if it doesn't pick up quickly,
Yeah, so
so it's like you're dehydrated.
two
Okay.
seconds. Yeah, remember 2 seconds is not 1, 2, right? It's one,
Right, right, right.
two. Yeah,
And two. Correct, correct. I mean, I never knew this. Thanks for that tip. So
no
flu
problem.
versus heat exhaustion versus fever. How do you tell that?
The flu will cause fever, right? In Trinidad, we have a way where people use the term flu very interchangeably with the common
Commonly,
cold, right?
yes. Mhm.
So, I mean, flu technically is influenza, which can be a more
Okay.
serious viral illness, and that one
Oh,
can
okay.
link. You can be sick for up to 14 days with that. Heat
Oh.
exhaustion, well, the history will guide you, right? So were you out in,
Mhm.
doing gardening for a long time? Were you running a 5K in very hot temperatures? Are you a soldier and you're training, military? So these things, the history will guide you
Okay.
towards that. Yeah.
Okay. Okay. So is it okay to exercise during the low grade fevers?
I know people will say you have to sweat your fever out and go, but no, I would always say to rest when you have your fevers, because there's a small chance of serious complications happening when you exercise. So
Okay.
rest, no exercise.
Okay. Okay. Ice baths for fever. Helpful, harmful.
Harmful.
Okay. Okay. Breaking fever reassures immunity. Yes or no?
Like if I break, no, it doesn't.
Okay.
The overarching thing is a little fever is okay, a lot of fever is bad. So,
Okay.
break,
Okay.
yeah, we don't want to break it. Yeah.
Okay. Okay. Thank you. Thank you. That ends our rapid fire round. Well, ladies and gentlemen, thank you so much for your time so far. Just to quickly summarize, in this recording or in this podcast of an episode related to fever, we have discussed about what is fever, how do you differentiate fevers, what has happened in the past with respect to the fever outbreaks. And Dr. Donna has also discussed with us in terms of differentiating the clinical protocols, diagnosis protocols, what should we do and what should we not do with respect to the fevers for children as well as for adults. We have also discussed some commonly asked questions by public with regards to the fevers. I believe this is an impactful as well as a knowledgeable episode for all of you. Dr. Donna, if you have to give your advice to the Caribbean population, especially with respect to the fever, either it could be related to the prevention or it could be related to the treatment or taking care of themselves. Please go ahead, doctor.
All right. You're going to get a fever at least once in the year. And just to be mindful of the red flags. So, fever greater than 39.4 degrees Celsius in an adult is usually a cause for concern. Trust your intuition. If your loved one is listless and not themselves, early intervention is better. It's better to be safe than sorry with your little ones. If it's a baby, and they're having a fever, you're gonna want to control it quickly. Um, have a low threshold for giving paracetamol to control the fever. And again, if they're not producing urine or wetting their nappies and they're not eating, and this is going on for more than 4 days, definitely seek medical attention and be mindful of the rainy season coming. No still waters around your properties. So cover your barrels, wash out your plant sources, all the things that we know that we've heard ever since, because it's a individual responsibility and a community responsibility as well too.
Great. Thank you so much, doctor. So, ladies and gentlemen, I believe this is a very clear statement from Dr. Donna Rampersad. The rainy season is going to come very quickly, and we are all prone for fevers. These are inevitable illnesses or medical conditions. However, there are some preventions and precautions that we can take as guided by the CDCs or the public awareness campaigns that are run by the governments or by the doctors, as simple as covering the open waters or remove the stagnated waters will not allow the flies or the mosquitoes to lay the eggs, which may cause severe viruses that may go unnoticed if you don't get a medical attention quickly. So I assume this episode has actually brought in a lot of understanding with respect to the fevers and how to take care of ourselves in the first place, how to prevent than looking at a cure. Once again, thank you all for your time. We really appreciate it. Dr. Donna, I can't thank you enough for unfolding a lot of mysteries as well as myths around the fever. Public needs this. Yes, it is a very simple topic. However, a lot of people do neglect this because it is a very simple topic. Once again, doctor, appreciate your time. We shall reconnect with yet another topic, which could be more interesting, which is also going to be very useful to the general public. You have a very good day ahead. Ladies and
All right.
gentlemen, thank you so much for your time.
All right. Thank you. Bye.
Any one of you having any of these symptoms, please feel free to reach out Medicus. You can download Medicus mobile application from Play Store or App Store. We also have a website www.medicasapp.com and you can consult directly one-on-one online.